I'm Dr. Govindan Sharma. I'm consultant physician, chest specialist, and diabetologist, presently working in Teen Plate Hospital, Jamshedpur, as head of the Department of Medicine. And today I'll be speaking on latest update in hypertension. So, as per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for cardiovascular disease. So moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively, as per the WHO statistics. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. The medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. This is as per the WHO Lancet 2021. The International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms address the issues that in resource-poor settings. The optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The American Heart Association and American College of Cardiology has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ASCVD risk. Among the low-risk adults, no atherosclerosis cardiovascular disease or 10-year CVD risk less than 10% with the stage 1 hypertension. Blood pressure 130 to 139 by 80 to 89 millimeter of mercury. Management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. So acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. This is as per Journal of American College of Cardiology, September 2021 issue. So lowering systolic blood pressure targets down to the 110 to less than 130 millimeter range, substantially reduce cardiovascular adverse events in the STEP randomized trial, affirming the sprint finding for an older Chinese population. So among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of the composite cardiovascular risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professionals societies range from threshold of 130 to 150 millimeter of mercury. This is as per New England Journal of Medicine 2021. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommend that the diagnosis of hypertension should not only be dependent on office blood pressure measurements, but also on the out-of-office measurements, such as ambulatory blood pressure measurement or home blood pressure monitoring. 24-hour and nighttime BP measurements were associated with greater risk of mortality and a composite of cardiovascular outcome. Thus, they may be considered as the most relevant measurements for estimating cardiovascular risk. For every 20 by 10 millimeter mercury increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. So most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommends 5 classes of antihypertensive drugs, considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and blood pressure control. Therefore, the 2018 European guidelines recommend, especially in the context of lower blood pressure targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitors or ARB plus calcium channel blockers or diuretics. So since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitroso-dimethylamine NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. So NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patient would have received NDMA contaminated valsartan from Beijing Huhai manufacturing site, where the highest levels of contaminants were found every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. So the presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. So valsartan recall accompanied by a significant increase in the rate of emergency department visits of 6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable cardiovascular risk reduction. The largest study included a total of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary CV outcome, and ambulatory blood pressure measurements was performed for 48 hours to collect data on how BP differed during sleep. The RR reduction for CV events were significantly improved for nighttime treatment when compared with the awakening treatment. Thank you.